going to talk about some hair, and we're going to try to get through this as fast as we can, and we're going to do a couple things. The first thing we're going to talk about is how to take some hair off, okay? Everybody knows about tweezing. Everybody knows about waxing. Well, once again, we are going to tell you what we do here at Cape Fear Aesthetics, okay? We use laser hair removal, okay? And it's a little bit differently from what you normally expect. Okay, all my students basically hold up 3 fingers, okay, because this is how you're going to be able to tell your client when you see them. You got three different hair follicles, one in the growth phase, right? One in the resting phase, and one kind of in between. When we use the laser to basically generate energy down there, we knock out the one in the growth phase, right? So if you just hit it one time, what does that mean? You're going to have some hairs that are not going to be caught. So that's why when they ask you, well, how many treatments do I need? Usually we'll tell them 6 to try to catch each hair in a growth phase. Does that make sense? So one and done is not the picture here. You have to come back and continue to do it. The other thing that we use is something called the Luminous diode laser. And what that is, it uses some vacuum assisted. So it looks like a little suction cup, and it actually draws the skin up under or into the vacuum. And that essentially allows the hair follicle to get closer to the heating mechanism. Well, if it's closer, we don't have to use as much energy. And if we don't have to use as much energy, we can use it on all skin types. Fitzpatrick 1 to Fitzpatrick 6. You with me? Flavors, vanilla to chocolate. Got it? All right, and all in between. Say again?
Everybody's about as
That's right, but you knew vanilla to chocolate, right?
I know vanilla.
Okay, we good. Okay. You may be a little mocha. Okay, we can handle the mocha too. Okay. But the difference, but the biggest difference is because we use this particular technology and the head that we have, the original heads were only about that big. Now they're about that big. Well, what does that mean to our clients? One is if we're doing an underarm, instead of it being 10 minutes or 15 minutes, we can do it in about 2. Bikini, we can do about 4. Brazilian, add another 2 minutes to it, okay? If we're doing the facial hair, we can actually get to that a little bit easier, whether we're doing a beard or things of that nature. But because we use less energy, less pain, patient is happier, better results. You feeling me? This is the difference between what's going on. Now, there was a question about training and, you know, estheticians and things. Those are things you want to ask. Who trained them? Going to a weekend course does not make you a laser certified, in my opinion. It just makes you dangerous. Okay? But the question is all about the experience. And I will tell you, and these guys will tell you, until they get a year under their belt where they start seeing their patients come back, the goods, the bads, and the uglies that can happen with a laser, they really may not understand or grasp the whole concept of it takes to do laser hair removal. Next slide. Any questions so far about some laser hair removal? The other thing now we want to talk about is hair growth. And one of the biggest things that we do is a medication called Latisse. You guys have seen the commercials. You've seen it with Brooke Shields. This essentially grows or lengthens eyelashes. It makes them bolder. It makes them darker. It makes them thicker. It is a prescription. The original medication came for those patients who were using this similar medication for glaucoma, for eye pressure. And one of the complications that they saw, especially even in my training, is that the eyelashes started growing to the point where we used to have to trim them because they were so long because we couldn't do an examination. And somebody says, hey, we need to figure this out. So they put it in a different medium, and they came up with Latisse. And as to see that essentially even at the baseline all the way up to 16 weeks, we do see this. Very, very, very rarely. I think I've seen one patient and all of them that we've actually used did not have great eyelash growth. Now, before you start buying this for your husbands and want to dunk their head into it, we really don't have a whole lot of science behind it that says it will grow, but I'm sure that there's stuff going to be out there that's really promising. Has anybody ever used Latisse besides my guys? Okay. All right. You like it?
Really big lashes. Yeah, I mean, yeah, but, you know, for me, I already have really freaky long eyelashes. So.
Gotcha. And literally, we can use it for those patients, even for the chemotherapy patients that are losing their eyelashes. As long as there's something there, we can help stimulate it. Think of it as like special fertilizer for the eyelashes. Everybody with me?
Yes.
We good?
Do you see any side effects with the
Good.
blue light?
The question is, there was a disclaimer on those that talks about essentially that there can be a eye or color change. I have not seen that in my practice for the past 4+ years. The only thing that two of my patients have said is they saw a little dark line right where it almost looks like eyeliner. So not a whole bunch. I haven't had any of my friends talk about, you know, changes in eye color. Very safe. If there's an issue or somebody thinks that, they just stop it. Once they get it to where they're going to be, which takes them about 4, maybe 8 weeks, instead of it doing every day, they'll just use the Latisse about 2 or 3 times a week for maintenance. Okay? All right. Next slide. So now let's talk about some hair loss. Okay? And this is the big thing we want to talk about. We want to do some recognition. Please understand that this is a two-way conversation. If you have a question that you want to ask for yourself or a friend, please let me know and we'll go over those things. But just to kind of, you know, just as a review or just to kind of get you up to speed, we have the first phase called the Antigen Phase, and that's essentially the growth phase. And you can see there that this phase of your hair growth can be going on for the next 3 to 6 years. The next phase is the Catagen Phase, which is your transition, which can be 1 or 2 weeks. You see what's happening is the hair shaft starts to separate from its blood supply and starts to come off. We are then left in what we call the Telogen Phase, where we just have the germinal papilla left, and essentially this shaft comes out, and then all of a sudden the cycle starts again. Everybody with me? So this is normal. By the way, bonus question for my students. How many hairs are you essentially, once you become adult, does the average human have? Anybody got any idea? Write it down to be on your test. 100,000. Now I'm going to tell you what that means in a second. 100,000. Okay? Let's go to the next slide. Now, one of the first questions that people want to talk about when they lose their hair is what products are out there? Is there something I can address? One of the first things we're going to talk about is low-level light therapy. Now here's how I want you to think of it. All this is grass. Some people got good grass in the backyard. Some people got good grass in the side yard. Some people don't have a good front yard or right down the middle. So we're going to talk about grass. And one of the things we're going to talk about is fertilizer. And one of the best fertilizers is the sun. So the question, we talk about laser light therapy. Now once again, all lasers are not treated the same, or treated equally, or created equally, I should say. Low-level light therapy is what we call a cold laser. It's at a certain wavelength, and the studies have shown that it is the proper wavelength that stimulates or upregulates the hair follicle. Think of it as just like, again, the sun. It stimulates the powerhouse cell, you guys remember mitochondria from Biology 101, and those are the things that cause basically to produce energy, giving food and essentially the nutrients and the growth for the hair follicle to grow. Everybody with me? So, depending on which, and there's only two, there's the we've seen some pretty good results with. One of them's the iGrow, and the other one in the US is called the laser cap. And it's essentially, once again, a bunch of electrodes, and this one you can actually wear for about 20 minutes a day. You can actually hook your iPod up to it. It gives you instructions. You can be on your computer and essentially just get your light stimulation from there. It doesn't cause any heat. It will not burn your hair, but essentially it gives you that all-around look. Some of you may even seen the laser comb in magazines, like when you're on the airplane and things of that nature. Similar product, however, you got to move it around. This is a little bit easier for you, less time. And the neat thing is, when those things are purchased, they're yours. So you can use them whenever you want to, okay? And it's for as long as you want to. Any questions or anything like this that they've seen? Yes, sir.
How safe are those?
Good question. Because it's a cold laser, we're not worried about injury to the eye, we're not worried about heat, we're not worried about cold formation or cell damage. It's once again light at a particular wavelength. Wavelength is about 670 nanometers, which means that's what we need. Versus if we use laser hair removal at about 800 nanometers, that gets picked up by pigment and kills a hair follicle. So depending on the wavelength, we can grow it or we can kill it. That makes sense? Okay. Any other questions? Yes, back in the back.
Will that work on alopecia?
Yes, it will. We're going to talk about that. There's different forms of alopecia. However, we can't grow grass on concrete. Okay? And what I mean is, if you have that scalp that has that shiny look, that hair has been miniaturized. Okay? That ain't coming back. You hear what I'm saying? But if you have a thin hair, and alopecia, that term is basically hair loss or thinning of hair, there are different types. Most of them will respond to, and this is just one form of fertilizer. Now please understand this. This does not grow hair that does not exist. It takes care that's already there. There's no medical treatment that grows hair. If that was the case, I'd be out of business. Okay, or you wouldn't need a hair transplant. But we're talking about how to maintain the hair that you already have. If you're waking up, you're washing your hair, you're combing hair, and more hair is in the comb and in the sink, this is when you start considering those as just once again to stabilize. You everybody with me? All right. Any other questions? Yes?
How often would you have to actually use it when the hair...
Eric, how often in our protocol do we use our eye grow?
Average patient uses it about 4 times a week.
About 20 minutes a day.
Okay. Would that be like lifelong thing or just until...
Go ahead.
Yes, it would be. It could be a that there's no cure for hair loss.
Mm-hmm. Any other questions?
How much does it cost?
Now, that's a great question, and please ask those questions. Now I'm going to talk to y'all as business people, especially my students. It's all about value, okay? There's some people in here that value some fingernails. There's some people out here that value their car, and there's some people here that truly value their hair. And when it comes across the population of the U.S., there's 2 things that will hit every person: hair and weight loss. Okay? So it's just about what that means. And if you do not feel that your particular client may not be willing to invest in that, then once again, it is about value. Now, you can't have Cadillac taste and Pinto budget. But please understand, right, okay? But please understand, if you want to know what it takes, because most people have spent a whole lot more than, what is it? $700 on creams, ointments, lotions, and potions that you may have suggested to them yourself. Okay? Now let's talk about that. Let's talk about a product. Shampoos. Shampoos basically will take that hair shaft and make it look a little bit thicker. You with me? And if you multiply that 100,000 times, that's a pretty big number when you go across the board. But please understand, you're not growing any hair. You're basically just holding that hair shaft is getting a little bit wider. But once again, multiplied 100,000 times can be a volumizing effect. Does that make sense? Okay. Any other questions? Next one. Minoxidil. You guys heard it before. It's also known as a brand name Rogaine. This is actually, you have the liquid and then you can have the foam. Well, the reason why they came out in the foam, because one, guys think they're moussing their hair. But the other thing is it basically causes less irritation when you're using that on a daily basis. About 20% of the users will talk about scalp itching or tenderness, and so they change that up. Some women will talk about a secondary hair growth on their face. They don't know if it's dripping down when they're using it, or if they get it, we just tell them, of course, stop it. Shedding or growth is actually, and growth is a normal cycle. So some people think that, oh my goodness, my hair is falling out when I start this product. And when in actuality, it's just a normal growth cycle, if you will. And then Propecia or finasteride is a DHT, which stands for dihydrotestosterone. And this is actually can only be used in males and women who are postmenopausal because it can cause birth defects. But this has a significant improvement for, once again, hanging on to your existing hair. Okay? Once again, so when your clients are coming in, should I use Rogaine, things like that, will it grow my hair? No. It will. We're trying to keep the hair that you have. The thing that we like to see when they come back is ask them, is there less hair in your pillow? Is there less hair in your comb and in your sink? And if they go, well, actually, yeah, then the medicine is doing their job. You with me? Yes?
Is there a difference between the over-the-counter Rogaine and prescription Rogaine, or is it now just over-the-counter?
It's actually comes in several forms. The Rogaine for women is 2%. The Rogaine for men, 5%. The Rogaine that I prescribe that gets done by my pharmacist, that I have them compound, 12%. Same price. So once again, there's a difference of when you're going to the physician who can hopefully basically speed up that process for you. Does that make sense?
Yeah.
Okay. Any other questions so far about the medications? Now we're going to talk about some quick treatments. And some of the treatments we're going to talk about, how can I get ready for church? I got a wedding to be in next week. My high school reunion is coming up. And every time them bright lights are on, my hair looks like I am bald and thinning. Sound familiar? Some of your clients and things of that nature. these are keratin fibers. Now, if you kind of look up the picture, what you're seeing is on that first round picture is just, once again, the hair follicles. The keratin fibers are literally just sprinkled on like a salt and pepper shaker. And that's what can happen literally in just a few minutes. And what happens, they cling to the shaft, and therefore you can see it looks like little porcupines. You with me? And that gives the appearance of a denser look when you're looking at it over top, just as you see right here on this gentleman. Does that make sense? It's in Sally's Beauty Salon. It just takes a little bit of time. And I can tell you most women over 60 who have thinning hair know about this product. Okay? You'll see a lot of stars use it before they go to the red carpet because the bright spotlights, if they have thin hair, it'll shine right through them. This is a Kim Kardashian favorite. Okay? Any other questions? Okay, so those two products are Topic and Antigen. Antigen is companies over in England, but the Topic is what you'll see here in the U.S. And so that is a great, hey, I need something quick and fast. It sprays in, you can actually swim in it, it doesn't leak, it's not ink, it's actually a fabulous product. Okay? I actually fooled my wife and told her one day I was getting a hair transplant. I sprinkled that on, freaked her out. Next slide. Tattoo and micropigmentation. This is actually more common than you think. For those individuals who essentially can shave their head or have a very low hairline, you'll see that they'll start thinning. Well, a good tattoo artist or micropigmentation can actually put that little dot in a basically pattern-like thing with a few different off colors, and it gives the appearance of them having a low fade. Make sense? It is actually really fantastic for that individual who is not ready for a transplant. It's immediate. And the other thing is we can come back behind that and actually do the hair transplant, and it provides less contrast between the scalp and the hair, and therefore it looks fuller. You with me? But you have to have somebody who's got a pretty good hand. If not, it just looks like they got a bunch of dots on their head. Right? It has to almost, the dot has to look like ugly. You know what I'm saying? It can't be perfectly round. Okay? So we see a lot of that. Next one. Now, these are some great questions, and these are the questions that your clients, that you may ask you, the common causes of women losing their hair. Now, first thing that we do is the difference is we don't speculate. We do a laboratory evaluation that is usually covered by most people's insurance carrier. The most common things is iron deficiency, and it's usually due to menstruation blood loss for women. That is the most common reason, and it's usually fluctuating, if you will. The second one is thyroid disease, and that's usually low thyroid. Sometimes high thyroid as well. But it usually, and when you're doing a laboratory evaluation, these are one of the most common things that we look. So polycystic ovarian syndrome. That is the patient or the client that comes in that may start a little bit of facial hair growth, has some unexpected weight gain that they just can't get off. And there's some other things that we do for the lab, and essentially their testosterone and estrogen ratio can be thrown off, which these ladies will not get the normal thinning of the hair in the middle and transfer out. They actually get male pattern baldness, which goes from the front and comes back. And so those are some things that we look at. The other thing is lupus is actually more common in women. It's more of an inflammatory and autoimmune process. Stress can, of course, do it. Quick weight loss, we've seen it before. Even in my weight loss program, we'll have some people that say, you know, my hair grew, then all of a sudden it came out. It came back, but we saw a little bit of thinning, or what I thought was breaking. Then the question about chemical treatment with straighteners and bleaching and things of that nature. What you're doing is irritating the scalp, and therefore if the sod or the dirt is not healthy, it's a little bit tougher for the grass to grow. Make sense? So we've seen it all the time. Now, for my women of color, you've seen and heard of Curly Nikki, the natural hair movement, all those kind of things. They do give you the opportunity to do those things if they so desire. And I'll ask more questions in them about that. But also just infections, acne in the scalp, and even fungal infections can, of course, cause some hair loss. But any specific questions like, hey, I've got this friend, I got this client, and I thought her hair loss was due to X, Y, and Z. Any of those questions at all? Please understand you're actually just speculating. Now I'm going to show you some pictures that you can actually start to recognize some of these patterns, but more importantly, the biggest thing that you want to do is send them to their primary care doctor or dermatologist or somebody like myself. Okay? Let's go to the next one. Now here's what happens with the female hair loss. Once again, it starts in the center of the head and then spreads out, and there are different grades of such. Usually when this becomes a problem is when they're looking in the mirror and they can see more of their scalp than their hair. They try to dye their hair a different color, and believe it or not, if we have a person who has pale skin, we would much rather have them have white hair because it's much more forgiving. Does that make sense? Okay. Any questions so far about a female? And this is the normal female pattern hair loss. All right, next one. This, of course, is the hair loss scale for men, top and bottom. When we are between 2 and 6, you know, that's something usually we can do. When we get to the 4, 5s, and 6, it's all about curb appeal. And when we try to replace hair, we're usually replacing the front yard. Sam, how tall are you?
6'3".
Ain't nobody looking at the top of your head, okay? So the bottom line is when you want to be cost effective to replace, you know, your hair, you want curb appeal. Does that make sense? You know, because people, oh, I need it up here too. Well, remember, when you lose or a client loses their hair, they start off at how many hairs? 100,000. By the time they get to 50,000, they're starting to notice that there is a change. You with me? So now it's taking those existing 50,000 blades of grass and move them to the back, to the front, so that we can get some sort of coverage. Does that make sense? All right. Next one. Go back for a second. Everybody can probably know somebody who's one of these, okay? Whether it's your spouse, whether it's, you know, Dr. Dickerson, any of those things, okay? Next one. Now let's talk about the hair loss evaluation. Actually, that picture is us actually doing a hair transplant. The patient right then and there is actually, at that point in time, he was watching us with a mirror. There's no pain. Why? Because he gets numbed up. We'll tell you how the hair is going to be harvested in another slide. Most of them are essentially either watching their iPads with Netflix, so this is not a painful procedure at all. And what's actually happening is literally we're putting in one blade of grass at a time, if you will. But we talk to the patient first. We kind of find out what's their hair use. Have you braids? Is it a weave? What are you using for your processed hair? Is there a family history? Tell me about scalps. Tell me about bleeding. Those kind of things. And usually by the time we finish talking to them, we have a great idea of what's going on. We use things like the pull test. We kind of gently pull their hair and see how much the hair pulls out. Is it very, you know, sensitive? There's something called a pluck test, which we won't go into. The scalp count, which literally we will put it under the microscope or the camera, we shave up, and we can count how many follicles they have per square centimeter. And that gives us a great idea. And then, of course, we can always do a biopsy if we're concerned about medical problems, if we're talking about lesions, if we're talking about a cancer. And then, of course, the laboratory evaluation that we had as such. So understand that hair loss, hair thinning is not take this off the shelf and shampoo your hair with this. I'm not against any of that things, but please understand I don't like to see those products being sold for several hundreds, if not thousands of dollars when we know, and now you know, that they're not going to do anything. So please understand the difference between marketing and science. And this is where we get caught up at 3 o'clock in the morning watching QVC, okay? Doctor recommended. You don't even know if it's a veterinary doctor, okay? But it's all about, you know, once again, understanding. And now with the internet, you can get some great information, whether it's on my website or somebody else's. Next slide. Any questions? Okay. These are one of the things we talk about that's a big deal is actually eyebrows. Now, there is everything from tweezing, depending on which, you know, decade you grew up with. Some of them were over tweezed. Some of them actually, you know, you don't know how many countless times. I'm sure there's probably a handful of individuals have the little piercing in the brow, or have, you remember back in the day, Sam, when they used to cut the little ridges, you know, whatever, and sometimes they don't grow back. So it's all about kind of doing those transplants. Or they'll do the permanent, makeup. And unfortunately, some of them look like Bozo the Clown. And so one of the things that we do, believe it or not, if it's in there and we can't take it off using our laser tattoo removal, we'll cut that skin out, close it up, and then we'll transplant over top of it. Don't shake your head. Don't shake your head. Because if it has value to you, you will sell your child. Yeah.
How many layers do you feel like when you size the tattoo? Like how many layers? Like
The question was, how far do we go? Believe it or not, there's going to be a lecture coming up in the near future for laser tattoo removal. But basically, depending on where the artist puts the tattoo, how long it's been there, how long it migrates down. If it's superficial, we can get off with different lasers.
Okay, now my son, when he was 10 months old, he wasn't with me at the time. His grandmother, he fell in his carrier and hit a jewelry counter, and he has a scar. And I took him to a plastic surgeon because I wanted to know how that would affect. And they said it would grow with his eye and his face. And now it's long. I mean, and most guys are, you know, something like that just makes me look tough. But how would you go about doing something like that?
Okay.
Part of it is missing his hair.
Right. So let's just say there's almost a gap in between this side and this side. There's just a bald spot or a gap there.
Yeah, it's like this.
Right. There's a couple things that we can do with that. Literally, we can actually excise the scar and bring the brow together, depending on how much play that we have. We can actually transplant hair right into the scar to camouflage it, and we can do that with burns. We can do that with people who've had trauma, car accidents, things of that nature. So believe it or not, we can implant hair into the scar, or we do a combination of both. The other thing that I would tell you, as long as his hair is actually growing, believe it or not, you can grab the Latisse that we use for eyelashes, but bam! You feeling me?
And make it grow.
Says doctor.
Let it grow, just let it
Exactly.
grow over.
Right. And so what you're doing is you're going to thicken up the brow and give him the Donald Trump comb over, but for the brow.
Well, I have actually waxed his eyebrows before because he's got really thick eyebrows.
He's got the unibrow.
That's why he's worried about having a unibrow, so I've actually waxed.
Eric will basically take those unibrow ones right there. He can harvest them right from that and move them right to there.
Okay, so that is something I can
That is an option. And if I take them from there, that means there's not going to be any brow, there's not going to be hair left. The individual with the unibrow, we can laser those off. Okay, just go. Okay, make sense?
Yes.
So that was worth the trip. Hey! Yeah. Now here's the neat thing. Most individuals who have that kind of trauma kind of thing, that evaluation is actually a medical one and can be covered by their insurance. The treatment may not be, but the evaluations, the labs usually are. Okay? Does that make sense?
Yes.
Anybody else have a question before we get for brows? Yes.
How much does it cost to usually get that part laser out?
The question was mid-brow laser. What are we talking about?
Eyebrow laser is about $100 a treatment.
$100 a treatment. Okay. Eyebrow transplant, if they, let's say they have nothing, starts at?
$2,000.
Okay, $2,000. And just to let you know, there is financing. I mean, it's 0%. I mean, literally, you can finance it for whatever you like. So, you know, once again, it's all about value. It's just all about what's of value to you. Okay?
Well, I heard a couple people just kind of go, but it is about value, and it's also about the actual artistry that's involved. And just imagine how tight-knit your eyebrows are.
Yeah.
Mm-hmm. So literally we stretch them out with little saline. I mean, and you saw that other picture where I'm sitting there with microscopic loops. And literally when we do one of our transplants, we'll show you what the pictures look at. And it's literally one hair at a time. So you're actually playing for that particular technique and that skill. Okay? Most good eyebrow transplants, you don't even know that they're there. And they can tweeze them, they can color them, they can do whatever they want with them because it's their hair. Okay? Yes, ma'am.
That's outpatient?
Oh, and we don't even go to the hospital. That's done here in my office. You're actually usually chilling. Hair transplants have Valium on board, and they're numbed up, so they high. They just don't care. They just either, or they're watching a movie. Usually there's a time in there where we literally break for lunch, have lunch together, patient's just kind of chilling out. It's not a pain, it's actually just a very tedious, and we have essentially a team of sometimes 3 to 5 people working on one person at a time. Okay.
I have one more question.
You got, I know you got more than one, but that's okay.
Well, he's 13 now.
Yeah.
What age would you recommend that?
When it bothers him so much that he's, you know, the girls are starting to be an issue.
Okay.
He'll tell you, Mom, I want this fixed. Now, more than likely, it may bother you more than it'll bother him. When it bothers him, he'll come and knock it. Yes. Any other questions about eyebrows? Okay, good stuff here. And we all know some people who've over-tweezed, or they should have just let that alone, and whatever have you, okay? All right, so follicular unit extraction is is now the gold standard, okay? The older method, which we actually use for most of our women who have very thick hair, is where we numb that up, make an incision, take out a row of hair, close it up. I will fool your hairdresser. She won't know that I've been there. I mean, because it's just a good closure, and we have the hair growing up through the incision. Then essentially a team of folks, to include Eric, they actually go back into the back, and they will literally dissect those hair follicles, literally 1 and 2 hairs at a time. It's truly splitting hairs. And then we prep that, and then we get ready to implant. Now the follicular unit extraction, I want you to think of a drill bit that's about less than 1 millimeter wide, and it's hollow. You with me? Everybody got that image? And what we actually do is this individual has these little hairs. We actually straddle that hair and we take it out, 1 at a time. Now when we do transplants, we may do up to 3,000 grafts a day. Okay, so you can see it's a very tedious, a very precise process. But if we do it like that, like I showed you, you will not be able to see a scar. Why is that important? Well, we live with the home of the brave over there with the 82nd and Fort Bragg. So this individual can wear a high and tight, get a transplant, and there's no evidence that we've been there. This is the state of the art that we do, how we do transplants now. The older way, there may have been a linear incision, and depending on who closes it, it may not look as pretty. Now, we don't necessarily do this for women who have very thick hair, because all we would do is we would take that out and then close it up, and then we don't have to worry about, quote, their hair being shaved. Does that make sense? So the guys will come in with a close cut. But depending on what's going on, we may actually, and here, understand, depending on how the weave is actually put in, we can actually turn the weave up and get back to the kitchen. Everybody know what I'm talking about, right? And we can actually get the hair from there, put it back down. And for my women of color, their biggest issue is traction alopecia right here on the side. And that's actually our easiest hair transplant to do. Okay? So it's pain-free. We numb them up. There's no scar, no downtime, a very natural appearance, and this is, quote, the gold standard for it. And it does cost a little bit extra to get it done, but, you know, once again, this is a value. Do you guys know that your vice president has had a hair transplant? Joe Biden? Yeah, he's got a hair transplant. The reason why you can't see it so well, it's got white hair. It actually blends and forgives very nicely. Any questions about follicular unit extraction? This is what you need to know, because the people are going to ask you when they're sitting in their chair. Or these are the questions that your friends are going to ask you, hopefully, when you come back. Go ahead. Oh, go back one. This is actually the method of choice for my men of color, okay? So my gentlemen who wear low haircuts, fades, and things of that nature, and we can do that without leaving a mark on their skin, and they have a very good result as well. And there's no downtime. I mean, literally, if they want to go to work the next day, they can. Wear a hat. Have a good time. Eric teaches them that. Yes, ma'am.
What about skin that tends to, you said men of color, sometimes their skin tends to keloid?
Let's talk about that a little quick. Keloid is a normal process of scar tissue and healing. It just doesn't shut off. And it's also about, you know, once again, getting a history. Let's go over about that too. Everybody understands that men or women will sometimes see the keloids in the back. Let's basically dispel some urban myths. That is not due to dirty clippers. Okay? Shut it down. I'm serious. It is not due to somebody didn't rub some alcohol after they got their neck trimmed. Didn't do anything. It actually has to do with the cut in the skin. Once that skin was cut, whether it's from a clippers, a straight razor, whatever, it heals normally with a scar. And as a surgeon, I like the word scar. You think scar is a bad, ugly word, but scar means healing. But what happens is the healing process and the collagen does not turn off. So it makes more scar tissue. The girls get the balls, you know, from the ear piercing. The guys get the pack of nerds. Okay? Everybody with me? Don't act like you don't know what I'm talking about.
Oh my God.
I'm from New York. I got more degrees than a thermostat, but we all know what we're talking about, okay? So, you know, that process is, and I'm going to show you a picture, but what's happening is it's normal scar tissue that just didn't shut off, and those individuals can be treated with medicine, injectables, and even lasers, okay? So that's a great urban myth that we've just hopefully squashed today, okay? And those individuals who are prone to keloids are not only prone to the keloid here, but usually other parts as well. You can see them if they get a follicular, you know, a PFB, or pseudobarbar folliculi, and get ingrown hairs, and they start having some keloids on their skin. It's normal scar tissue, just keeps going and going and going. You with me? Okay. Next one. Any other questions? Next one. So let's get a couple of things. So this is alopecia areata. Okay. Now, patient comes in, or one of your friends, or you may notice some people when they take the wig off, that they start having this patchy pattern. Notice it's not geometric, there's no triangles, there's no circles, there's no shapes. I mean, excuse me, more of a square, I should say, not a circle. And what happens is it's usually an acute episode. It can be basically a life stressor. It's usually seen in younger individuals. That up top is not a fungal infection, okay? It's just a circle, but you need that. When did that come on? Oh, it just came on. Tell me what's been going on. Oh, we just moved here and I'm not too crazy about my school. That's a very common story, okay? How about the individuals right here? Hey, I just delivered my third child and all of a sudden my hair started falling out. This patient does not need a hair transplant, just needs a little time. Why? Because the vast majority of those people just resolve over time, okay? So it's not about buying a lotion, buying a potion, doing lab work. It's figuring out what's going on in their situation, okay? And you usually will see, you know, they'll tell, oh yeah, you know, my mother said she had the same thing after she gave birth to me. Everybody with me? All right, so these are little recognition patterns. We're going to end up with these. Next one. This is called Antigen Effluvium. Remember, antigen is the growth cycle for my students, and effluvium, we're losing hair. This is what we see when a patient has chemotherapy. The antigen phase, the hair follicles are growing rapidly. Chemotherapy or cancer drugs affect rapidly growing cells like cancer cells. So not only does it kill the cancer cell or affects the cancer cell, it affects rapidly growing hair follicles, i.e. hair. So they'll lose their lashes, they'll lose their brow, and they'll lose their hair. But notice how some of this is still left. That hair is in the telogen phase. Why? Because it's not growing very rapidly. You with me now? Okay. Any questions so far? Okay, good. So this is not somebody that's basically strung out on crack or meth or whatever. It's once again figuring out what's going on with them. Next one. Asian hair. Most people think that Asians don't lose their hair for whatever reason. That's actually a little myth, but they're actually more prone to losing their hair than our average American population. Here's the difference between them. They have a much wider and rounder hairline. Also, that shaft is actually more round and straight and it's black. This is a very tough hair to transplant because they have a pale scalp and dark hair, and that hair is straight. If we put a little curve into it, we cover more surface area. Everybody with me? So this is and depending on how much hair that they have, this is a really tough patient. And notice, we got him hair, but you notice his hairline isn't coming far down. Why? Is it's not natural, and two, we may not have enough hair to move from the backyard to the front yard. So he got like a little front yard. You understand what I'm saying? Okay. And the other thing is how the hair, here's the other thing. For you cosmetologists, watch how the hair comes out the scalp, okay? Watch where it comes on an angle. Watch where the part in a men's hair where the hair comes out this way and it comes out this way. Understand what a lateral bump is, and when we're doing hair trans, we try to make sure they have that little fluff right here. We all have it. Look at the men of color who wear a low haircut. There is something called a swirl back there. Anybody know what I'm talking about? Some people, no, it's not a cowlick. It's a swirl. And it actually happens on either side, right versus left. Most people have one, very few people have two. And when you're putting in a hair transplant, you want to be able to mirror that little swirl or whirlpool. That's what makes a great hair transplant, not just putting hair on the head. Everybody with me? Because we can put hair on the head, and then if you basically just got it sticking out like they want to have a frohawk, that's not going to work. So you want to make it very stylish and things of that nature as well. To include, look very closely at an eyebrow. There's an angle that starts here, and then it goes the other way, and then literally there's a meshing of the brow at a certain point of the arc, and that's how you put the hair back in. They just don't all go this way, okay? And that's what we're talking about. All right, next one. The Hispanic hair. This is a tough one because it's not Caucasian, it's not Asian, but when you start, mixing into what we call the term mestizo that we use in plastic surgery, it's a Caribbean, it's an African hair, it's a European hair. And the biggest issue is you have to talk to the patient and say, well, what kind of hair do you want? Are you looking for basically a full head of hair? Do you just want some front yard? And it's just about making sure we meet those clients' goals. Okay? Next one. Here was your question, and this is the first one. I'm sorry it doesn't come out to it. This is where they have those little dots, and these are small little keloids. What's happened is this individual has got folliculitis, or inflammation of the hair follicles, and it caused an inflammatory reaction and just said, make scars. So that's why you got these little dots. It has nothing to do who cut their hair. It has nothing to do with the cleanliness of the clippers. It has to do, once again, scar formation. And some people literally have this all over their body. And it's almost impossible to heal. It's very unfortunate for them. The one on the lower bottom is, once again, what we see for the men of color have shaven bumps. And you know, once again, that hair basically grows and then curls back in and causes a little irritation. What's the treatment for shaven bumps? Raise your hand. Yes.
I know somebody that uses
answer the question.
exfoliate.
Huh?
Exfoliate.
Hang on, did you have the answer? I'm going to let you give the answer. Did you know? I'll get you a question. Exfoliate. Anybody else? Get rid of the hair. How do you get rid of the hair? Laser hair removal. That's the only thing that's going to cure this. Okay? The good news is you have to have a laser that does it on the chocolate flavors. And that's usually a YAG laser or the one that we showed you before. So that's the only thing. But if you get rid of the hair, especially for those of us who spend, that person now doesn't have to have a shaven profile. Does that make sense? Now, we can get this same problem for women in the groin area or even in their underarms. You get rid of the hair, you don't have the problem. You know somebody.
That uses soap and glue with like a hard scrubber brush. And it works.
Right. Now, what they're doing is usually they're trying to prevent that hair from curling under. Whether that, you know, you'll have everything from, oh, I just relax the hair so it's straight. Or I just brush the hair so it's straight. So therefore the hair doesn't curl and they don't get the inflammatory process going. This same individual that's on his neck, depending on what his skin type and flavor is, can wind up with that problem. Okay? But if you get the hair out of the way, you calm it down with the steroids, you can improve that significantly. So yes, exfoliation works and you're just trying to keep that hair from curling under. You have any comments on that?
When it comes to exfoliating, I mean, just trying to exfoliate the top layer of skin, that, you said the issue worked, and they're using Seltzer blue. I'm going to have to say it's probably some of the sulfate as well. It helps to dry it out, so that's probably why.
Did you hear that? Yeah. So, you know, there's plenty of remedies. I've heard everything from toothpaste. I've heard everything, once again, you put the little, you know, as I'm relaxing their hair, they put it on here so then they can trim it off. I've heard a bunch of things, you know. We talk about, you know, once again, shaving, you know, with a, not a razor, but a electric razor, and that's just a little bit less irritative to the individual skin. Okay? The one up top in the right-hand corner, this is what we're concerned about, scarring alopecia. We would see more of this, of course, with my women of color who, let's say, having a more heat damage. Come on in. She's telling you to come in. Don't be messing up my video. Should we bust them out like the comedy club? Okay. Come on in. Now, what we see here is this is an individual who's got too happy with the hot comb. Okay? So once again, we know, okay, I'm going to talk to my folks here who got a little bit more gray hair than like I do. Remember the comb that was on the stove? You heat that one up. You had to get it just right. You had to okay, now it's ready. But what happened was with the pulling and the traction, basically actually burned or basically irritated the scalp. And therefore, we now have scarring alopecia. Now, if we stop doing the products and things like that, they get better. However, that hair may be gone. So that's when we have to transplant. We may try some medication, but once again, we can't grow grass on concrete. Okay? Okay? And then the one over here all the way to the right is what we see the most of, and this is traction alopecia. This is from the time that they were 5, braiding their hair to almost braided so tight it looked like they turned Asian. You know what I mean? And what's happening is they will get this patch, the supermodels, everybody, and believe it or not, that is one of our most happiest clients because they usually have great thick hair. We remove a strip, do that, and they're back to work literally in a day or two. Okay? and it grows. And because they have great thick hair, it is their hair. And it will grow, and they can press it, and they can curl it, and do whatever they want with it. It is their hair. Very quickly. Just like I can take hair off anywhere, I can move hair. So whether if you do not have hair on your head, but you got a hairy chest and back, I can move it from there to there using that 1 unit follicular unit extraction. So we can move hair around. Not so much in this particular country, but Asian people will ask for underarm hair or facial hair or even pubic hair. You can move it around, okay? It is their hair. And once again, wherever you put in the grass, as long as it has a blood supply, it'll take, okay? That's actually just good to know. You'll see these, of course, with transgender surgeries. I don't do any, but of course, you know, once again, those issues, and that's how they do that, okay? Next slide. Also, once again, as you see, the African American hairline has a straight hairline. There's no other culture that we have that wants this. But the question is how high and how low that you actually see that. This, once again, we're trying to show the thinning of the hair from the traction, alopecia, and the weave. Now, you got some, I ain't giving up my weave. Don't need you to. However, we talked to them about putting their weave to where we can get to the donor area as well as the area of harvest. And depending on how it's done, they can keep the weave in, and as the hair grows, they can take it out over time, and all of a sudden they're left with a full natural head of hair. Okay? Like I said, the dark scalp and the dark hair is a lot more forgiving. Next one. This essentially just ends up the show. You guys have been fantastic. We got a bunch of questions.